We are now. Thank you all for voting very quickly today. I see you're getting used to the poll functionality, so we appreciate that. I'm going to give it just a few more seconds. So if you're in the middle, try to finish up. All right. Thank you for taking time to do that. And I am going to pull up Rachel's slides and then we can let Rachel get started. All right, Rachel, it's all you.
All right, thank you. Good morning, everyone. Thank you for having me. I'm Rachel Cooper with Every Texan. This is what, the third year, I think, fourth year I've been presenting to this conference. And while I'm glad to skip having to drive to San Antonio, not that San Antonio is lovely, I just could do without the drive. I miss being in the room and seeing all your faces, but I'm still happy to be here and present. So for the most part, I'm going to talk about SNAP today and a little bit about the pandemic EBT program. Obviously, there are other really important nutrition programs that are working and helping our families throughout this COVID situation, but these are the ones that most affect you. So next slide, please. All right, so SNAP matters in Texas, especially. As you guys know, because you're on the front lines, you're dealing with the families directly. Hunger has skyrocketed during the pandemic. Food insecurity rates have always been high in Texas and always been higher for families of color, but through COVID, they have hit records never recorded before. So reported weekly rates of hunger reached more than a quarter of whites, 26.8%, said that they were food insecure in the last couple months. For Black and Hispanic families, those numbers have been 37-38% of all households. So it is are struggling to put food on the table. So it is a dramatic change and a desperate situation for lots of families. And so SNAP has done mostly what it's intended to do. It has kicked in to help respond to the crisis. So the chart shows what SNAP enrollment starting back in January of 2018, right? And where we were at around 3.9 million Texans were on the program. And that's roughly been the average number for years. It goes up and down, but roughly there's always been the 3.94 million Texans on SNAP for years. And then starting in January of 2018, you see that we started losing participants. And if you remember from last year's session when we talked about this, it was largely tracked partly with the improving economy, but it had much more to do with the public charge debate. and the fears that were happening within the communities and people leaving and dropping off of the programs because it was showing up across programs. And when we talked last year, we talked about SNAP being down by 11% in that time period, that same time period. But if you see, right as the pandemic hit in April, we went into lockdown in March of 2020, and by April, there's this the numbers just shot up. And by the end of the month, we had erased all of those cases that we had lost, and we are back to serving 3.9 million Texans, 1.7 million households. So SNAP works, and SNAP is important. Next slide. So I'm going to talk more about what has actually changed under COVID, some of which hopefully you guys are already familiar with because you're working and dealing with SNAP and helping families enroll, but some of which is brand new. And so we'll just feel free to put any questions you might have in the chat box. And I said we'll leave some time at the end if you want to ask the question out loud. So let's first talk about work requirements. As most of you know, SNAP requires lots of adults to work. And there are two different populations that we normally break this into. And both have been given some leeway and requirements eased because of the pandemic. So the first group, the able-bodied adults without dependents, the ABODs, those are, folks without children at home, basically. They normally have to work at least 25 hours a week, or they can only get SNAP for 3 months out of every 3 years, right? And so Congress stepped in for that group and put into the first stimulus package that passed, they put that rule on hold for the duration of the public health emergency lifted. So ABODs do not have to worry about being kicked off of SNAP because they aren't able to find work throughout as long as the public health crisis lasts. The second group are basically the parents who need to be fulfilling a work requirement. So they have children over the age of 6. That is a state rule that requires them to work. Other states don't actually require work participation for that group, but Texas is one of a handful of states where we have a mandatory work requirement. So that group has been waived at the state level since the pandemic started. When this waiver for parents will end is uncertain. It is, like I said, it's up to the state discretion. What I've been told is that they were waiting to see what happens when the folks who are on unemployment, when they are being told to go back to work, their work requirement kicks in. Once they see how that goes, then they will decide to phase back in the requirement as well for SNAP households. They tried to do this earlier in the pandemic, back in, I think, June or so. They tried to put the unemployment folks back on a work requirement, and they had to pull it back in a week when they realized the economy, the situation wasn't safe enough. So we don't know when this will be. It'll be kind of controlled by the governor's office when this will happen. So we will let you know as soon as we know something. The only other big change is, and I'm not sure when you will see this take effect because, as I said, right now the work requirement is suspended, but the SNAP ENT good cause system is being revamped because they were audited by the feds, and the process is being changed. And so there will be a new form that families will receive to report their good cause, of which is basically why they should be exempted from the work requirement. And so if you see that form in the coming months, it's form H1818. We can share more guidance on that as we know more, but just as a FYI, that might be coming in soon. Next. Okay, so the next big thing is the interviews. This is where you guys see the most connection to the system. And so, as you've probably already realized, the system is trying to go back to normal. And this is not so much an HHSC decision. This is being driven by the federal government, and HHSC is controlled by USDA when it comes to SNAP policies. And so initially USDA nationally, because of COVID, things were so chaotic, they waived the interviews, the eligibility interviews, both at initial application and at recertification nationwide, right? And then as the situation continued for months, they started having states having to show that their conditions were such that they couldn't go back to the normal process because they were so overwhelmed, or they didn't have enough workers because they were out sick with COVID, those kinds of situations. Texas had gotten the waiver up through August. They applied for it for September, and their request was denied. USDA, the Division of Food and Nutrition Service, FNS, they feel that Texas is in a good enough place in terms of processing cases, timelines, and all of those things that the interview should restart. A similar thing happened for the renewal process, in that all the folks who were due to renew since the beginning of the COVID emergency the feds realized that the states simply could not handle all the new cases plus recertifications. And so they allowed extended enrollment for those recertification cases. They just gave them an additional 6 months without having to do paperwork, right? And so ever since March through August, all of those people who came up for re-enrollment were given an additional 6 months. September's request from Texas was denied. So starting September, all of these cases, everyone is having to go back and actually do the recertification process. So you guys should have seen by now, that starting September 1st, all new applications are having to do the interview, the telephone interview. The recertification process is being phased in a deal that they cut with USDA. I don't know the exact timelines. I haven't seen the timeline of how this is supposed to work, but what they have put out is that right now, if you're recertifying with just SNAP on your case, then there is no interview. If you're trying to recertify and you're also applying for Medicaid or TANF, you do have to do an interview. My guess is that by November, everybody will have to do the interview at recertification, unless something happens like a major hurricane where they're forced to do, huge work trying to get, emergency benefits out, disaster benefits out, something that overwhelms the system, then basically all the waivers that we've been getting all this time will disappear unless that happens. Unless there's some shock to the system that the enrollment system and HHSC is overwhelmed, FNS is pushing the state to go back to normal operational practices. All right, next. Okay, so benefits. You guys should have seen that the benefits have increased for a lot of families under COVID. Basically, this is also a national thing that happened, that since April, all households were given an emergency allotment authorized by Congress. What the law said was that 2 months of emergency allotment should be provided, which is basically, they thought that it would be a short-term situation and the country would have recovered by the summer, which obviously didn't happen. But that was how the law was written. How it was interpreted by USDA was that everybody on the caseload on SNAP should get the maximum benefit for their household size. That is a good thing for folks who were only getting small amounts, say a lot of elderly folks who, would only get the minimum $16 or so. That was great because they were pushed up to what the maximum for that household was. So if they were elderly, single, instead of $16, they would be getting $200 a month. It's not so great for the 40% or so families who are already getting the maximum amount, the poorest folks on SNAP, because they didn't see any increases or any changes to their benefits. And that is a point of contention between the way USDA has interpreted things and the way advocates have interpreted things. And in some states are suing USDA to fix this. And so we'll stay tuned. Maybe we'll finally get some extra benefits for those lower income families. But for now, we're at a month-to-month situation with everybody getting the max. This is the one waiver that has continued. The state has applied for October maximum benefit. As of yesterday, they still hadn't gotten word. So hopefully it will come through. I think it will, but we don't know. USDA is playing games at this point. So we just have to wait and see. If it does come through, what families will see is the supplemental extra that they get will be distributed in about the second week of October. That's typically how they've been doing this. And what happens in November, we don't know. Another big change that happened that hopefully you started to notice, last year we talked about a bill that had passed during the last Texas legislative session to change the SNAP distribution schedule, the HB 1218. The bill actually went into effect early. It was scheduled to go in later in this month, September, but it actually went into effect June 1. And they actually changed the way the original bill language. So traditionally, SNAP cases, people received their benefits in the first half of the month. Everybody, based on their schedule, received their benefits between the 1st and the 15th of the month, right? And so that will continue to be true for anybody who was initially certified for SNAP before June 1st of 2020. So even if you had a SNAP case in the past and you're known to the SNAP system, you have an EDG in the system, you will still get your benefits between the 1st and the 15th of the month. Anybody who goes into SNAP on or after June 1st, 2020, new to the system, brand new case number, they will start getting their benefits between the 16th and 28th of the month. Everybody. So from now on, you're going to have this bifurcated situation where old cases get their benefits in the first half, new cases get the benefits in the second half. This was at the request of the supermarkets, basically, to kind of handle the number of people shopping and even it out across the month. Another big change that you've seen is that SNAP households can now purchase groceries online. Unfortunately, it's only with Walmart and Amazon at this point. More retailers are applying, but that process is controlled at the federal level, and they probably are overwhelmed with all the supermarkets on the country trying to do that. So we don't know when more grocery stores will be approved in Texas. All right, next slide.
We've got about 4 minutes if we want to leave 10 minutes for Q&A.
Okay, it's going to take a little longer than that. So
that's fine. We can make it work.
Okay, so the next, let's see, we want to talk about income. So just some update on the rules of how income is counted, because it is different between SNAP and Medicaid, right? You guys should hopefully have figured this, been told all this already. The stimulus payments that most people have gotten the first round, we are definitely trying to do outreach to a lot of folks. There are millions of folks who didn't qualify because they qualified for the stimulus, but they didn't get it because they don't normally file taxes. So if you're helping those families, be clear that the stimulus payments do not count against their SNAP income, so it will not affect their SNAP benefits. One thing that does count is if people get unemployment insurance, including federal pandemic unemployment. That does count, which is different from the Medicaid rules. The complication in the last month or so has been the $300 lost wage assistance payments that some folks got who were after the $600 unemployment boost ran out. People were told that it did count towards SNAP. HHSC made a mistake in that. FNS finally clarified that no, it does not count, and HHSC is going back and reviewing impacted cases and should be making adjustments. If you know of a family who is denied because of that, let us know, and we will monitor, make sure that they are correctly counted going forward. And just so you know, PEBT benefits, and we'll talk about that, they don't count as income. So anybody who applies for PEBT, they get to use it to buy food, but they don't have to report it to anybody. Next one. Okay, so this is news to me. This just came up yesterday, but I thought you guys should know. If you're working with clients on SNAP CAP, that's the combined application process, which is folks who receive both SNAP and SSI, and those folks are normally certified for 36 months. Starting October 1, the notices will go out that folks in SNAP CAP are actually going to get a cut in benefits. Folks who were getting $75 a month will now only get $55 a month. Folks who were getting $130 a month will only get $122 a month. So you may be seeing clients getting these notices and might be freaking out, and I don't blame them. Hopefully as long as we're still giving the maximum benefits, this doesn't matter, because people should still get the full amount for their household size. But it is a huge issue and a problem, and I'm going to be reaching out to HHSC to try and figure out what we can do, or how these numbers are being calculated. But in the short term, you might want to consider, if you have a client who's affected by this, you may want to consider looking to see if what they would get if they went through the regular application process instead of SNAP cap, if their benefits would increase dramatically. The downside of that is they have shorter certification periods if they do that. So you really would need to work with your individual client to figure out if it's worth it. Next slide. All right, so I'm just going to go through quickly with PEBT, what it is and how it has worked, and the really big news that happened last night about PEBT. So for those who know, PEBT was for kids who missed out on school meals when the schools closed down. The families got an EBT card. Either they were on SNAP and they got a boost on their SNAP card, or they were sent a separate EBT card, and they could use those to purchase groceries. What made PEBT so successful and important is that it was one of the few programs that didn't look at immigration, because school meals doesn't look at immigration, and so public charge rules didn't apply. And so a group of people who desperately needed help were able to get something through PEBT. In Texas, we reached 2.9 million kids. $817 million was pumped into the economy over the summer because of PEBT. We've been stuck waiting to figure out what Congress is going to do to reauthorize the program, because it is officially ended. And just last night, finally, the House, congressional level, they passed in the continuing resolution, which is the budget that keeps the government funded and open for the next year. They passed a continuation of PEBT for this coming school year, and it also puts in some really needed fixes, with the biggest being that young kids who would normally be in childcare would finally be included in PEBT. So first the Senate needs to pass it, and then we'll go from there. And so it'll be a few months before families will see the money, but this is really good news. So yeah, next slide, please. So one of the things, just for those folks who attended last year, I spent a lot of time talking about the proposed rule that was out there, which impacted categorical eligibility, which would lower the levels of income levels for enrollment into SNAP and the asset test used in SNAP. So it's a really bad proposal that was, public comments had been taken. It would kick more than 10% of all SNAP households off the program in Texas. So we were really trying to stop this from happening. Basically, we don't know what's happening. All of those bad rules have just kind of been frozen within the agency, I think partly because, one, they should be focusing on the pandemic, and two, it would look really bad if they tried to do that in the middle of the pandemic. So status is unknown, so we will keep you posted. Obviously, it's dependent on how the election goes. If the White House changes, this rule is dead. If it doesn't, then we shall see. Next slide. And so this is just a quick update on SNAP legislation, what's happening nationally and at the state level in the coming session. So what advocates have been trying to do as part of the COVID relief package is increase SNAP benefits for everybody to better reflect the cost of living. So basically they were asking for a 15% increase in SNAP. That has been stuck for months, and so, you know, as people have seen, that those negotiations are not going well. So I'm less and less hopeful that that will happen, but you never know. Renewing PEBT for the school year, for this coming school year, that was also stuck in that COVID conversation for months, but thankfully it has more bipartisan support. And so, as I said, it's been moved to the continuing resolution process, and that is expected to pass, although, you know, the way things are going at the Senate right now, who knows? If we avoid a government shutdown, we should get PEBT. If they shut down the government, PEBT is not happening either. And then obviously undoing the public charge rule is also high on the list, but that will completely depend on what happens with the election results. At the state level, the pieces that are happening, last session, the Feeding Texas, which is the food bank network, and ARP and worked really hard on a bill that we also support, which is simplifying the SNAP application process for seniors and the disabled, which would also give them the 36 months enrollment without going through SNAP cap. The bill didn't make it all the way through, so getting that passed this session is going to be a priority. Raising the SNAP asset limits has always been something that we've worked on, and it's never gone very far, but I think the pandemic has shown the importance of that, and so we will be working on that again this session. And fixing SNAP ENT for when it does come back into effect is also something that needs to happen in Texas, including how college students are treated, because college students are in this weird hole with, if they are full-time students and not working full-time too, they're not eligible for SNAP. So it's a difficult situation. So we're trying to do some fixes to that. And then, of course, saving the HHSC budget, protecting it from any cuts that are proposed, will be on the agenda. So that's it on my slides. I think I talked fast enough in the end. And I'm happy to answer questions.
Great. So we have a couple of questions already queued up. If participants have other questions, please feel free to use the raise your hand function or put them in the Q&A box, but we do have a few already that came in. So Cesar has asked if, it's more of a comment, but he said, we experienced patients being denied during the expansion. So that's June through August, and it's been very confusing. So he wanted to sort of provide that experience there. And I don't know if there's something you want to respond to there, or we can also ask Cesar to come unmuted if he wants to add anything.
Yeah, I mean, I'm happy to hear more. I think, you know, it's not so much that the rules changed, so people would still be denied. It's just some of the technical stuff, like the interviews that were changed and the recertifications that were changed, but there wasn't any real change to the income restrictions or anything like that throughout, because of the pandemic.
And then Sharon has asked if can grandparents who are doing off-site schooling with their grandkids get food stamps for children who did not receive free school lunch and breakfast but are not attending school on campus? Okay, so I think you're trying to, the connection between SNAP and PEBT is what she's talking about. So
kinship families, grandparents, can qualify for SNAP if the household meets the SNAP rules, SNAP income levels. Because SNAP is calculated at the household level, it's different than the Medicaid rules where a grandchild living with a grandparent and doesn't have a parent in the household doesn't have income, so they are qualified as Medicaid eligible. SNAP, they look at the grandparent's income as well to calculate whether the household is eligible for SNAP. Once a child is on SNAP, they are automatically eligible for free school meals. Once they're automatically eligible for free school meals, they are eligible for PEBT when it comes back into effect. If the child doesn't get SNAP because the household doesn't qualify, they may still qualify for free school meals, but they have to fill out the application. Or if they are on Medicaid, they can qualify for free school meals. So you just kind of have to check that situation. But yes, if they are eligible for free school meals, they should be eligible. They are eligible for PEBT when it comes into effect. The kids who were on SNAP got it automatically. The kids who weren't on SNAP had to fill in an application online. We don't know what's going to happen with the next round, how the state's going to do that.
Great. And then that just to clarify that point, we do have one question come in from Mary Lou. Please confirm that the deadline to apply for PEBT has closed, or was it extended again?
It has closed. For PEBT, for the schools that were closed in the spring, it's closed. What we're waiting to see is if this new bill makes it all the way through, the continuing resolution is passed through Congress, they will do another round of PEBT for the current school year. And so the amounts will be different, the rules will be slightly different, and there will be a new applications window once we know more. Great.
And then we have one from Jennifer, and I'll go ahead and take this one because it's actually about Medicaid, but just it's important that we're making it clear how this works. So for Medicaid, does regular unemployment with pandemic payments count for income? And for all programs, your base unemployment is counted as income. So that's true for Medicaid, that's true for SNAP. But that extra $600 a week that people got during the summer through July, that was not counted as income. That was very clear. HHSC did count earlier. Rachel mentioned the lost wages assistance. That also comes from the Texas Workforce Commission, the unemployment agency here in Texas, but it is FEMA dollars. HHSC had included that as Medicaid income, just like it had included it as SNAP income, and it was also incorrect to do that for Medicaid. That should not have been included, and they are going back to address that policy and address any cases that may have been negatively impacted. They're in the process of doing that now. And I think we have one thing just for clarification. Apparently, there were several SNAP cases that were denied because of change of address this summer. They're saying that they saw a lot of that happening. So that may have been some of what Cesar was seeing. So I think the final question, and we can move on to Healthy Texas Women, is it seems to be a big difference in the SNAP cap amount. One is $20 and the other one is only $8. And Susan was wondering why that might be.
It's a good question, which I cannot answer, unfortunately, because I don't understand how they calculated the amounts. From what I understand about how SNAP cap works, it's kind of, the state's basically saying that to do SNAP cap wouldn't cost any more than if folks would get SNAP through the regular application process. And it's a cost neutrality thing they have set up with the federal government. So I don't know how they reach those new numbers. And so that's one of those things I'm trying to, I'll be reaching out to them to see if they will share that. And it is a problem that, you know, a $20 cut is a huge amount. So that's why if you're working with a client, I suggest you think through whether or not it makes sense for them to stay in SNAP-CAP or do something else.
Great. And there's one other question here, and it's Rachel, feel free to add anything. Is it better to advise our clients to report any income from any source when applying or recertifying, regardless of whether it's going to be counted? I think that is, in general, if you're applying on yourtexasbenefits.com, a good rule of thumb. The agency will go through and identify what should and shouldn't be counted, and you certainly don't want any questions as to whether or not they withheld information. The one caveat I would put to that, and Rachel, feel free to add anything else. If you're applying on healthcare.gov, that is a real-time eligibility determination done by a system. Those systems cannot be updated as quickly as they need to be. So for example, this summer, the advice we gave to folks was if you're applying for a special enrollment period for ACA subsidies on healthcare.gov, do not put the stimulus payment in there. It would have counted, it could have potentially incorrectly counted that as income. And again, that's just because it's a system doing the eligibility determination in real time, as opposed to it going to a worker who can help piece out what should and shouldn't be counted. So I think there are certain instances, especially with healthcare.gov, where that may not be true, but in general, reporting the income and letting HHSC decide, piece it out is good advice. Rachel, do you have anything to add to that before we move on to Erika?
Yeah, I think you're right. I guess if I knew it didn't count, I wouldn't bother. I wouldn't risk it if I knew it didn't count. If I had a question, I would report it and just make it clear the source of income so that, you know, they are accurate on the other end. PEBT, it is a school meal benefit, is not considered income, so it does not count.
Okay. We really need to move on to Erika. If we didn't get to your question, we will make sure to follow up with you. We do have everyone's email addresses from registration, so we appreciate that. All right, so give me 1 second, Erika, and I will pull up your slides. And thank you so much, Rachel, for that wealth of knowledge. I learn everything every time I hear my colleagues present, so super helpful. All right, and we will turn it over to Erika.
Hi, everybody. Good morning. Thank you to Every Texan for inviting me to present today, and thanks to the other folks that are putting on this great conference, TAC and Young Invincibles. I'm excited to be back here. I had the pleasure of presenting with Rachel last year in person, so I do miss your faces, like she said, but excited to be here. So a lot of changes have happened, namely to Healthy Texas Women, so that will be the focus of the presentation. And like Melissa said, my name is Erika Ramirez. I work for Healthy Futures of Texas, and we run the Texas Women's Healthcare Coalition, so that's the majority of my work. Next slide. So now you know who I am, and so who are we? What does the coalition do? In case you're not familiar with us, so we're a coalition of 87 healthcare advocacy faith organizations from across the state. Every Texan, TAC, and Young Invincibles are all members, and we appreciate the expertise that they lend to the work that we do. And what we do is we strive towards access to preventive healthcare, like Melissa said, including contraception, which is an important piece. Next slide. And I always like to kind of clarify. So I think folks, when we say preventive healthcare for women, what does that mean? What does that encompass? And so when we talk about it and the work that the coalition does, these are really the benefits and the services that we focus on. Not to say that the breadth of women's health is not important, it really is, but these are just kind of the focus of our lens. And we support other folks that are working on maybe like postpartum care and some of the other pieces that do touch on this. Next slide. And so the programs that we focus on in the work that we do are the Women's Health Program. So there's the Family Planning Program and Healthy Texas Women Program. And the majority of the presentation today will be focused on changes to Healthy Texas Women, just because there's not really that many changes going on to Family Planning Program. And we hope it stays that way. We hope there are no budget cuts. We hope only improvements, right? And so I just like to orient folks, because they are similar programs, on just some of the key differences. So for Family Planning Program, you see that there's the kind of high level, in the nutshell, eligibility, and then the covered services. And really, once we go into Healthy Texas Women, you'll see there are a few key differences. One of them being that the Family Planning Program, which many of you all, I'm sure, know, serves both men and women, while Healthy Texas Women only serves women. The age ranges are a little different. So Family Planning is age 64 or younger, which is a higher range than Healthy Texas Women. And the FPL limit is higher, so it's 250% of the federal poverty level. And also, Family Planning Program, as part of the eligibility process, does not ask about citizenship. It only asks about residency, so you have to be a Texas resident. Next slide. So here's the same high-level slide, but for Healthy Texas Women, about eligibility, determinations, and covered services. Oh, and the key difference also is Family Planning Program. Eligibility is determined on site at clinics that are contracted with the state in order to participate in the program. Whereas HTW, as you can see, you can apply on, like, there's a paper application similar to Medicaid, where you can use the paper application, or you can apply online at healthytexaswomen.org with an online application. So you don't have to do it on site. A woman can do it from the comfort of her home, or somewhere. And as you can see, some of the differences here. So the age range is 15 to 44. So it's a little more limited, right? For the younger, for adolescents, 15 through 17, you need parental consent in order to sign up. The FPL is a little lower there, it's 200%. HTW does ask about citizenship, and it follows the same rules as Medicaid around citizens and eligible immigrants for eligibility. And you can't be pregnant in order to be eligible. And it also has a little bit more in this covered services. It's like limited preventative health care, like screening and hypertension, diabetes, cholesterol, and postpartum depression. Next slide. And you guys might be familiar with this. I know I also presented about it last year, but there's just this policy piece that I always like to hone in on, so people are aware, especially you guys that work with folks and getting them connected to access. So there is a policy in place to help promote continuity of care for women during their postpartum period, where when a woman is in Medicaid for pregnant women, and then she gives birth, she has 2 months of Medicaid coverage left. And at that point, she is determined automatically, without having to reapply right now, for HTW. And if she's eligible, she's just moved into the program. She's sent out a letter letting her know, and then she gets HTW for 12 months postpartum like normal. And so she's able to at least have some connection to the healthcare system prior to that, if she has no other access to coverage when her Medicaid is up. And there's like kind of like a little, you can see the process. Next slide. And so you guys might probably be familiar with all of these like COVID-19 updates as they pertain to Medicaid. I know Melissa does a great job of keeping folks informed, but I just always like to kind of point to what benefits also cover in the women's health programs, because some of them do related to COVID-19. So because of the Families First Act, right, we have this freeze in Medicaid disenrollment because of, the MOE. And so that also pertains to Healthy Texas Women. So right now, they shouldn't be losing their coverage, even if it's past the 12 months, and then they reapply, they should be maintaining coverage. And then women on pregnant women's Medicaid are maintaining their full Medicaid coverage through the emergency period, right? So the auto enrollment process that I just kind of showed you, that actually shouldn't be happening right now, because a woman should be maintaining her coverage in Medicaid, even if it's past the 60 days. Next slide. And then, as most other programs, COVID-19 testing is now covered both under the Healthy Texas Women program and the Family Planning program. And some of the same telehealth and telemedicine services and flexibilities that have been authorized in this time are also applicable to HCW and FPP providers. And like I said earlier, so like that maintaining coverage, they're automatically renewed right now until the emergency period is declared over. So all of that should be happening for these women as well, just like it is happening in Medicaid. Next slide. So here we come to the first of kind of like the changes that I'm going to really highlight today for you all for HTW. So there was an 1115 HTW demonstration waiver that the state applied for back in 2017. And this year, before the pandemic, in January 2020, CMS approved it. And so because of that approval, there are going to be some changes. And just for some context, so when we say 1115 waiver, like, what is that? So there's a provision in the Social Security Act, Section 1115, that allows HHS to let states waive certain federal guidelines on Medicaid. So it allows states to kind of do innovative things and pilot approaches to serving clients. And most waivers, they're time limited and they expire, and they have to be budget neutral, which means that there wouldn't be any more money spent on this program than there would be regardless in a regular Medicaid program, is the main piece of it. And so prior to, I guess, in the former iteration of Healthy Texas Women, we did have a waiver in place to draw down federal funding for the women's health program. But then there was the removal of like the provider protection piece, where Texas decided to have some qualifications around which providers could participate and which not, and which providers could not participate. So then CMS withdrew or did not agree to continue that waiver. And so that's when we moved into a totally state funded, and it became Healthy Texas Women. But then the state resubmitted the application in 2017. So just a little background. So now here we are, the waiver has been approved. And what this means is there's a change in method of finance. So instead of it being fully state funded, we're now drawing down some federal dollars. So for family planning services, that's a 90-10 match. For other types of services, it's a regular federal match. There's no change to the current provider eligibility for participation in the Healthy Texas Women program. So what that means is you still have to, in order for a provider to participate, they have to be a Medicaid provider, and then they also have to certify and sign their attestation form saying that they don't have any affiliation with abortion providers. For now, it will remain fee for service, so it's not being moved into managed care, and like Medicaid, so it's still fee for service. And there's no slated changes to the benefits through the waiver, the age range, or the FPL limit as of now. But there will be programmatic changes. So next slide. So eligibility, which affects you guys, right? Especially in helping women gain access. So because of the waiver implementation, CMS has directed the agency to switch to the financial eligibility methodology for HTW to modified adjusted gross income, or MAGI, which is what the other Medicaid programs use currently, as directed by the ACA, right? And so HHSC has to come in compliance by June 2021. So these changes are proposed and like being planned for. I just want to make sure that you guys know they're not in place right now. This is in the future. They have to have them in place by June 2021. So that gives us time to figure out what are the impacts, are, you know, have some time to advocate, right? Like what do we need to make sure that is in place so we can maintain the best access that we can maintain. So as a result of the waiver, HHSC has announced that they intend to terminate 3 crucial policies, one of them being that auto-enrollment policy that I went over a few slides back, that really helps promote that continuity of care for new mothers. Going from pregnant women's Medicaid into HTW. The other being adjunctive eligibility. So right now, women that are applying for HTW that are already enrolled in either WIC or have a child in Medicaid or like they receive SNAP or TANF, they don't have to like re-verify their income eligibility. That, you know, because they're so similar, so they kind of they skip that process. And it's kind of express through adjunctive eligibility. And they're also going to terminate use of the simplified HTW application form. So right now, the application form they use is the H1867, and it's a short 1-page application. The online app is really short too. And so providers are super familiar with it. The clinics that have been participating in these programs are super familiar with it. And so it really helps expedite the process of helping women apply and get enrolled. Next slide, please. So why are, you know, are there things that are concerning us? What's going on here? So those 3 items do concern us as advocates for these programs and making sure that women have access to them. So already the programs are, I wouldn't say, I mean, they're growing, right? But we had, you know, they're not as many women are being served as could be. Like there's already a huge demand. And so putting any policy barriers in place that will make access harder is never good. And we definitely don't want that, especially kind of during COVID-19, right? During this global health pandemic, when even the uninsured rate is climbing ever higher. Texas already has the worst uninsured rate in the country. It's just not really a time to be placing administrative burdens or barriers on clinics, women, or, you know, providers. So the impact that it'll impact continuity of care. We already have a maternal mortality and morbidity issue, so we don't want that. And we don't want it to impact access. So for auto enrollment, the proposed change that the agencies put forth is changing it to the administrative renewal process, which you all might be familiar with, because that's what the process that's utilized for other Medicaid programs. And if you are, and I know Melissa does a lot of advocacy around this in that aspect, it's not a great system, right? It sounds good, right? Ideally, if they're able to verify income using electronic data sources through the administrative renewal process, then they don't have to reach out to a woman and it's all done behind the scenes, you know, but we know that doesn't happen most of the time. They do have to reach out, and so it's not really as seamless as they present it to be. And so that system would be implemented for women that have just had a baby, right? So things are crazy. And so she's going to have to provide income verification within 10 days in order to maintain some kind of continuity of care. And they're claiming that there's not going to be any issues to case enrollment, but we just don't see that happening. We think that, you know, right now it's happening seamlessly. If you put something where someone has to send something back, there's definitely going to be some drop off. And then removing adjunctive eligibility and the simplified HTW application. So this is going to increase burdens on women and the clinics that serve them and the agency employees as well, because it'll be a longer application and there'll be more applications that they have to verify if you remove adjunctive. And we just are trying to get data from the agency now of what kind of cost analysis and impact analysis they've done based on the burdens that this will place in order to get applications approved. And so we're really going to be working towards now through June 2021, and we see the next legislative session as also an opportunity to put forth, so to try and mitigate the impacts of these. We understand that the agency has to come in compliance with MAGI, but we think that there are solutions that can mitigate some of the impacts here. One of those would be let's improve the administrative renewal process across the board. And so we'll be working very closely with Every Texan and other partners on seeing how we can do that. And then maintaining adjunctive eligibility. That was something that CMS approved in the past when we had this waiver. It's always been a part of the women's health program, so we think there's room for negotiation there. And then also exploring post-enrollment verification. So what that would mean would be getting a woman through the door and then giving her more time on the back end to send in documentation to verify items like income, so we can make sure that that continuity of care is maintained. Next slide. And another big change, I'm trying to get through all the changes, and then I'm very excited for you all to ask questions and also to let me know kind of like the impact you all think might be happening because you work with folks day to day and helping them access services. But so HTW Plus has been announced. And so you may or may not have seen, I believe the only really outreach that the agency has done so far is sending out a press release that there's a new benefit package that's going to be available in HTW. And this is separate from the waiver. This is put forth by Senate Bill 750 by Senator Kolkhorst last session. And so it's state funded, and it's a time limited benefit. It's only for 12 months, and it's geared towards postpartum moms to combat some of the maternal mortality and morbidity concerns that we've seen. So there'll be pink cards geared toward HTW Plus, like there are today for HTW. But I really want to stress that this is not comprehensive healthcare coverage. So I know there was some confusion. Folks thought that maybe this was 12 months postpartum Medicaid extension, and it is not. It's not the same level of coverage. And so we just really want to make that clear that while it adds some more benefits to HTW Plus to address this, it doesn't give the full comprehensive coverage that we would like to see for women during the postpartum period. Next slide. And so here is the benefit package that we've seen so far. There's some new cardiovascular related benefits. You can see them there. I bucketed them out kind of the way they bucket them out. Diabetes management services. So you can see these are kind of like chronic condition management pieces. We were excited to see like additional psychotherapy services and peer specialist services for postpartum depression and other mental health. Because right now in HEW, you can get screening and like limited treatment, but you can't really get like specialized counseling. And then you see there's some substance use disorder related services as well, and tobacco cessation, asthma medications, and supplies. And so this is a high level list that we've been provided. We're waiting for more information from the agency to kind of get like nitty gritty and be able to parse out what exactly is the difference between HTW and HTW Plus and some of these outside of kind of the very specific example I gave you, because we have that piece for sure. So they announced this September 1, so it's still new and it's technically available now. But the message, right, there hasn't been a whole lot of messaging around it. So we're not sure exactly how many people know about it. And they need to build a provider network, which hasn't been done yet either, in order to recruit some of these other providers to participate in the program to provide these services, right? So given that HTW is mainly right now, right, a family planning program, you probably might not have providers that can do some of these cardiovascular things, right? You might not have this, social workers and counselors and therapists that are aware of and into the program to be able to refer women to be able to access these benefits. And so right now, their plan is to reach out to MCOs in order to recruit providers for the network, but that won't happen until October. And so even though this is technically live and rolled out there, there's still a lot of legwork to do in order to make this actually helpful for women and like a viable option. Next slide. And then also a budget update. So that's one of our top priorities, is protecting the budget and protecting women's health budget. And we've already hit the ground running. So you all might have seen a lot of media about this. As a response to COVID and the recession, the big three sent out direction to all state agencies to reduce their budgets for the current biennium. So we're not even into next session yet, right? The current biennium. And Every Texan with Eva has done great coverage on this. So they have to make 5% reductions for this biennium. And so the initial HHC proposal had cuts to client services, including HCW and FPP, and also like administrative cuts to eligibility and enrollment staff. And so we put together letters, we notified legislative members, we sent a letter to HHSC, as well as other great organizations did. There was great media coverage on it. Every Texan, Texans Care for Children, Everybody Texas. A lot of folks kind of put our voices together to say, this is the last thing we need right now is cuts to healthcare, right? And so HHSC last week released a revised proposal, and yay, there's no direct client cuts, which is really exciting, and take that as a win. So those were off the table, but we still see the cuts to eligibility, enrollment staff, and program administration services, which we don't need right now because, as you all know, it's really important for HHSC to have those staff in order to process applications, in order for folks to get enrolled. And so really right now is the time to look for revenue solutions and not cuts to any of these vital safety net care programs. Next slide. Oh, and why does this matter? Why do we don't want cuts to women's health? Well, get up on my soapbox. They did that in 2011, and we saw, like, I mean, I can just say, like, we're still recovering from cuts to women's health care. So the drastic cuts that happened in 2011, we saw 82 clinic closures, 41 decrease in clients served, and increased costs actually. So these programs save funds. So not only is it helpful, like we want to make sure that clients maintain services, it's actually good for the fiscal health of the state as well. Next slide. And oh, there's my contact information. I'm sure you have it, but and then just our staff for TWHC. So thank you guys. And I haven't been looking at the chat, but I'm happy to take questions now.
I'm glad because get ready, you have a lot of questions already. So, which we're so glad everybody is engaged in asking questions. Okay, the first one comes from Amanda, and she would like to know if a DACA student would be eligible for Healthy Texas Women's.
So that would depend on their citizenship status. So I know I'm not as familiar with DACA and what, you know, and what like level, right? So it's obviously like if they're not a legal permanent resident and they're completely undocumented and not starting that process, they wouldn't be eligible for HCW because you have to have some sort of eligible immigrant status, but they could apply for a family planning program. And Melissa, feel free to add more to that.
Yeah, no, that's true in general across the board. So DACA was passed in such a way that they're really not eligible for any type of service, with the exception of something like CHIP perinatal, where immigration status isn't a consideration. So from an eligibility perspective for health programs, documented students are very similar to undocumented. So great question. And now Delia, excuse me, I tried really hard on that one. She asked, it says immunizations. Does that cover flu shots? I think that was probably for the Healthy Texas Women slide.
Got it, yeah. That is a great question. I want to lean towards yes, because they provide preventative care, but I actually want to go back and check the manual for you so I don't steer you astray, but I'm happy to follow up with you after this.
No problem. We'll make sure there's a few that we may need to follow up on from this session, because we have so many we may not be able to get to all of them. So I'll make sure that we can follow up with her. And then it's Kari is asking, so no need to do an application for a Healthy Texas Women after the 2 months of postpartum?
Right. So if everything is working as designed, right? So if a woman is on pregnant women's Medicaid and receiving Medicaid through that program, it should be done automatically to see if she's eligible for HCW in the background, and she should be getting a notice in the mail letting her know if if she's eligible and moving forward. No need for an extra application.
And in a similar vein, so sort of on the same process, what triggers the HCW eligibility letter after delivery? Is there a flat time limit after initial pregnancy Medicaid application? Is it delivery reported to the state, which triggers that letter to be sent? There's a curiosity around how that process works.
I'm just reading the question to you because it'll help me. So just give me 1 second.
No problem.
Usually, so on the back end, what triggers the exact system in tiers, I'll have to double check it because as tiers is want, there's been some back and forth on that piece as far as like what is it working accurately, you know, and is it moving forward in that way, and so we know that the time is triggered like 30 days after delivery, the tiers cascade happens, but I want to double check that it has to be triggered by an actual delivery reported to the state. And I would, if Melissa knows, then I'm happy for you to chime in.
Typically, so I don't know about the HTW piece of it, but typically it would be any sort of an end of a pregnancy health service that could trigger so that's what would trigger the 2 months of postpartum. I assume they're using that same trigger to start the time clock for the 30 days postpartum, which is when the second piece for the HTW eligibility would work.
Yeah, that's what I want to say as well, because I know it mirrors the Medicaid process and it's that same trigger because it's part of the same cascade.
Yeah, I believe that's true. But just to be clear, it's not actually, it doesn't have to be a birth. It can be any sort of medical process that would indicate the end of the pregnancy.
To trigger the 2 months postpartum coverage.
That would trigger the postpartum. Mm-hmm. And then Krista would like to ask if there's room to advocate for additional screenings or education, ergo around intimate partner violence in addition to substance use. And she did post this as you were talking about HCW+.
Thank you for that context. Krista, I believe so that there is, and I don't know because we had conversations with the agency just to kind of learn more, and we're still ongoing because, like I said, it's kind of they're still rolling it out. But they said that they were unable to get feedback from stakeholders prior to the rollout of the new benefit package because of a time crunch and everything else going on. They had to be live by September 1, but that they hope to make additional improvements as needed moving forward. So I would love to hear more about what you think would be helpful and needed in that vein.
If you're not familiar with Krista, she works for the Texas Council on Family Violence. I think I got all of those words in the right order, and I'm happy to connect you with Krista. Then there was one in the chat, so I'm trying to get these in order. Do you know if they're limiting provider types that can bill for these services? Again, related to Healthy Texas Women Plus.
So as of now, they are not, as long as you, and this is as we're getting in conversations, this isn't in writing. So I feel like everything around HCW plus, I just want to put a disclaimer, could change because it's evolving right now. But in our last conversation, as long as a provider meets all the qualifications, so is a Medicaid provider and then gets certified as an HTW provider, then they would be able to participate.
All right. Sorry. We have so many questions for you that I'm actually having a little bit of trouble making sure we get to them all. Will HTW plus be a different application from HTW?
No, so there won't be an application for HCW plus as of now. It'll be just a package. They really want it to be part of this continuity of care piece of once a woman goes through postpartum, there are no plans for an additional application piece, which I think is interesting. I'd be happy to hear from you guys on like what are scenarios where maybe you would need a separate application for HCW plus because maybe a woman needs those postpartum care services, but wasn't on Medicaid or something like that, right? But as of now, no plans for a separate application.
And then Katie wanted to clarify, women should maintain pregnant women's Medicaid at least until the public health emergency, correct? So no one actually would get into HTW plus even if it was up and running, right?
That right now, that's correct. No one should be transferring over. They should be maintaining their Medicaid coverage.
Okay. And so that I think that sort of speaks to Patricia's question here for HW plus, how can we submit applications or how can women be enrolled?
That, yeah, it's really supposed to be on the back end once the emergency period is over, and then we will see it go. I mean, technically it's live, but we'll see how it's working and what that looks like. And there's not a separate application as of now.
Okay. In the past, we have encountered clients that have been approved by mistake. So wrong citizenship assumption by a state worker. How would you address that situation?
Approved for HTW by mistake, and then it just not be corrected.
Yeah, I think we've actually seen some folks get in this. This may end up being a cascade. And so this may be something we can follow up with Cesar on specifically, because we've been getting reports of women who appear to not be eligible for pregnant women's Medicaid getting in instead of CHIP perinatal. And so that may also be sort of impacting Healthy Texas Women's as well, if there's a similar issue there. So I'm happy to follow up with Cesar if that makes sense, Erika.
Yeah, that does make sense. I definitely would want to know more about that. And if it's a cascade issue, we can work on escalating that, because I wouldn't want anything to, I mean, I think from a client perspective, hopefully they would be able to get services, but from like a provider perspective, if that was flagged and if they have family, like participate in the family planning program, I think preemptively, that might be a way to mitigate that. But without knowing more of the details, I think this is like an agency fix that might be needed. So yeah, follow up would be great.
Sure. And then a couple of questions around the adjunctive eligibility and presumptive eligibility. So just to make sure, the adjunctive eligibility has not been removed from the application process?
Not right now. No, that's a proposed change. So right now it should still be current. They haven't made those changes yet.
And then are there any changes to the presumptive eligibility process for the new HTW patients?
No, there are no changes to presumptive on the table right now, but that might be something we explore as another avenue to improve things. We're still looking at that, but from an agency perspective, to answer your question, no.
So sorry, there's so many questions, and again, we may just warrant some follow-up because we are coming up on time. So I think we have one more, and that is, if they have a green card, can they apply for HTW Medicaid? I have had some that have been denied because they have to be a green card for 5 years or more. So I'm happy to talk a little bit to help at all with that one as well, Erika.
Yeah, no, well, I was just going to say, so HTW follows the Medicaid policy on citizenship. And so that includes having the 5-year bar, right? So in this case, so they have to have the 5 years or more in order to be eligible. Melissa, do you agree? You can.
Yes. Well, it's actually more than that. So in Texas, we're one of only 6 states that limits our Medicaid to a very small number of non-citizens. So not only would they need to be a lawfully permanent resident, they need to be here for 5 years, but they also have to have 40 qualifying quarters of work in order to be eligible for a Medicaid program. So that would be true of HTW, and it would also be true of pregnant women's Medicaid. So yes, they would not be eligible for HTW unless they also had the 40 qualifying quarters, or they were a specific non-citizen type, the humanitarian statuses like a refugee or an asylee. Those are specific types that don't need to meet the 40 qualifying quarter requirement.
Right. Yep.
So Erika, I hope you will be open to additional questions, I will send you the list, and we do have everyone's contact information. So if we didn't get to your question today, we are going to make a big effort to make sure that they're addressed. And I think that some of what was left over is just that there's a lot of new information on Healthy Texas Women's Plus since it's so new. So we really appreciate you presenting that and starting the conversation on that. I do want to make sure that we do the post-webinar survey. So I'm going to go ahead and launch that now. So before everyone logs off, please do take a minute to answer these quick questions for us so that we can do a proper evaluation of the before and after folks. Big round of applause to Rachel and Erika, an incredibly large amount of information all in one webinar, especially just willing to sort of come and talk to us as things are changing. We know that both of these programs have had a huge roller coaster of changes this year, so we just appreciate that. And we will continue to provide updates from these experts through our different distribution lists. If you aren't signed up for this afternoon's webinar, please do take a minute to go on to the conference website. We will have a webinar this afternoon talking about how to do application assistance remotely. And then we've got 2 more webinars tomorrow. So we look forward to that. And just a big thanks to our presenters for today.
Thanks for having me. This was great. And even if you guys don't have a question, but if you just want to send things around your experience with eligibility with these programs and how you see some of these changes might be impacting that perspective, I would also love to hear as we navigate some of these solutions. So thank you all in advance for your expertise. And thanks to our wonderful host, Melissa.
Thank you.
Thanks, everybody. It was really informative. I learned a lot from Erika and Melissa, as always. And as they said, if you have individual questions or you're having clients hit roadblocks that you're like, wait, that's not what it's supposed to be, please let us know. That's how we solve these problems, is from getting input from you guys about what's actually happening. So thanks again and have a great day.
Yep, and I'm going to shut down the poll and stop the recording. It'll just take me a minute, but thanks everyone for your time today.